In this lecture, we are going to discuss chloramphenicol. Chloramphenicol is basically a nitrobenzene containing antibiotics. So nitrobenzene basically depresses the bone marrow. So that's why chloramphenicol will also do the same work. We will see later how. First of all, we will look at the mechanism of actions of the chloramphenicol, that how chloramphenicol basically inhibits the translation process of the bacteria. So basically in the bacteria you will see the two ribosome subunit. First one is the 50S and second one is the 30S ribosomal unit, bacterial ribosome. Okay. In between them, you will see the presence of the messenger RNA. So in normal process, you will see in the central dogma, you will see the synthesis of the messenger RNA from the DNA. Okay. And from the messenger RNA, you will see the synthesis of the proteins. First process is actually called the transcription and the second process is actually called the translation. So basically chloramphenicol plays its role in the translation process. Okay. So if we look the normal mechanism of the translation process. So first of all, you will see here is the 50S subunit, here is the 30S and here is the messenger RNA. So basically messenger RNA contains different codons that actually translate into the different proteins. Okay. So you will see the three most important side, E, P and the A side. E for exit side, P for peptidyl side, A for acceptor side. Okay. First of all, first tRNA, transfer RNA bind at the P side. Okay, here is the transfer RNA containing the amino acid and here is the amino acid. Okay. Similarly, second transfer RNA will attach at the A side and that tRNA also contains the different amino acid. Okay. Now you will see the two RNA first bind at the P side and second bind at the A side. And after that you will see the binding of the, or you can say bond formations between the different amino acid. Okay. Here is the bond formation. Now this bond formation between the different amino acid will be done by an important ribosome that is actually present in the 50S ribosomal unit. So basically in the 50S ribosomal unit you will see the presence of most important ribosome, that is the peptidyl transferase. So basically this is the peptidyl transferase. So it is important to know that this peptidyl transferase is not an enzyme. It is actually a ribosome because it is actually made up of RNA, not protein, because proteins actually enzyme made up of proteins. So it is actually a peptidyl transferase, that is actually a ribosome. Now this peptidyl transferase will actually make bond between the different amino acid. Okay, that is the normal process happening in the bacteria. Okay, but when someone take the chloramphenicol first of all enter into the bacteria, and then chloramphenicol, if I say here is the chloramphenicol molecules. Okay, now chloramphenicol will attack on the 50S ribosomal unit. Okay, and after binding to the 50S ribosomal unit, it will actually inhibit the activity of the peptidyl transferase. When you see the inhibition of the peptidyl transferase, then you will see there is no protein formation and there is no polypeptide formation. When there is no protein formation, then you will see the bacteriostatic effect. So basically chloramphenicol is actually a bacteriostatic drug, bacteriostatic, but if the concentration of the chloramphenicol increase, then it can convert into the bactericidal effect. So that is the important thing. Chloramphenicol can act as both bacteriostatic and the bactericidal. Okay. An important thing, bacterial ribosome and the human mitochondrial ribosomes actually similar. So that's why chloramphenicol can also affect on the human mitochondrial ribosome as well, and due to which you can see the bone marrow toxicity. Next, you will see the resistance. How different bacteria develop resistance against the chloramphenicol by producing most important enzymes that actually inactivate the chloramphenicol. So most important enzyme that will be the acetyl transferase that actually inactivate the chloramphenicol. Next, you will see the decrease intake of chloramphenicol into the bacteria. Okay, that is the important. When there is no chloramphenicol inside the bacteria, then there will be no effect of the chloramphenicol on the peptidyl transferase. Okay. Next is the alteration in the binding site. If you bacteria do some alteration in the 50S subunit, then you will see the chloramphenicol can't bind properly at the 50S ribosomal subunit. Okay. So here are basically the different resistance mechanism. Next, we will see the spectrum. So basically, chloramphenicol is a broad spectrum antibiotic used against the gram-positive and the gram-negative bacteria. So most important bacteria, you will see the H. influenza, Haemophilus influenza, Neisseria meningitidis, Streptococcus pneumoniae. So here are basically the three most important bacteria and encapsulated bacteria that actually cause the meningitis. Okay. Chloramphenicol can also be used for the spirochetes and the Rickettsia infection as well. Okay. And next you will see drug interaction, how chloramphenicol interact with the other drugs. So basically different drugs like the warfarin, okay, there are basically the different drug warfarin, phenytoin, and the tolbutamide metabolized inside the liver. Okay, here is the metabolism of the different drugs in the liver with the help of the different system like the oxidase enzyme. Okay, so basically chloramphenicol actually inhibit this system, oxidase system, and ultimately it will inhibit the metabolism of these different drugs, warfarin, phenytoin, and the tolbutamide. And ultimately you will see the accumulation of these drugs inside the body. So this is how chloramphenicol interact with these different drugs. Okay. Next, if we look at the pharmacokinetics, so most important, chloramphenicol can be taken through the oral route, IV route, and the topical route. So here are basically the different routes like the oral route, IV route, and the topical route. Okay. And most important, chloramphenicol is actually inactivate in the liver. So most important enzyme that actually do this work will be the glucuronoside transferase. Okay. So basically, if you see chloramphenicol actually metabolized inside the liver and convert into the inactive glucuronide. Okay. Here is the conversion of the chloramphenicol into the inactive glucuronide with the help of the enzyme that actually present inside the liver, and that enzyme is actually called the glucuronoside transferase. This enzyme actually convert the chloramphenicol into the inactive glucuronide, and after that this glucuronide actually excrete from the body with the help of the urine. So it means that this enzyme glucuronoside transferase is very much important in the metabolism of the chloramphenicol. Okay, if you see the deficiency of this enzyme, then you see the chloramphenicol will start increasing inside the body, and that will also happens in the baby. We will see later. First of all, if we look at the different adverse effects of the chloramphenicol, so most important adverse effects, that is the bone marrow toxicity, or you can say bone marrow suppression. So most important adverse effects, bone marrow toxicity. Okay. In the bone marrow toxicity, you will see the anemia. Okay. Most important, you will see the anemia, because the bone marrow is very much important in the synthesis of the different bloods like the red blood cell, white blood cells, and the platelets. And in the anemia, you will see the different categories of the anemia. You can see the dose related anemia. Okay. First one is the dose related anemia. When the dose of the chloramphenicol increased, then you will see the inhibition of the RBC's maturations in the bone marrow, and ultimately you will see the dose related anemia due to the increase in the chloramphenicol dose. Okay. Next, you will see the dose independent, okay, anemia. Dose independent anemia, specifically aplastic anemia. Aplastic anemia. Basically, aplastic anemia is actually the dose independent. It doesn't depend upon the dose of the chloramphenicol. So basically, in the aplastic anemia, you will see the depression of the all cell line, like you will see the reduced RBCs count, reduced WBCs count, and the reduced platelets count. And you can easily check it out through the report, and that will be the CBC. So in the CBC, you can easily check all the different cell lines, and that is actually the aplastic anemia, and that is mostly irreversible. But dose related anemia is basically the reversible if you stop taking the chloramphenicol. Okay. And last, you can also see the hemolytic anemia as well. Okay. And that is mostly happen in patients who are actually G6PD deficient. Okay. G6PD deficient. Okay. Here are basically the different categories of the bone marrow toxicity. And next you will see the gray baby syndrome. Gray baby syndrome. Gray baby, does the baby look like gray? Yes, exactly. The baby will look like gray in color, and syndrome, you will see the different symptoms as well. So basically in the gray baby syndrome, so basically in the baby, you will see, as we have discussed, in the infants, you will see the deficiency or the decreased amount of the glucuronosyl transferase, and ultimately due to the deficiency of the glucuronosyl transferase, chloramphenicol will start accumulating in the body of the infant, and ultimately that actually causes the gray baby syndrome, because after accumulations of the chloramphenicol in the body of the infants, you will see the it will affect on the human mitochondrial ribosome. Okay, so basically in the gray baby syndrome, you will see the cyanosis. You will see the skin of the baby will turn into the gray color. So that is actually the cyanosis. Okay, you can also see the decreased breathing of the infant, and you can also see the cardiovascular collapse. Okay, and you can also see the vomiting. So here are basically the different symptoms related to the gray baby syndrome, and in severe cases you can also see the death as well. So here are basically the gray baby syndrome that is important related to the chloramphenicol. Okay, and last you will see the GIT disturbance. So basically, it actually chloramphenicol, due to the direct contact of the chloramphenicol with the mucous membrane of the GIT. So that is actually cause the GIT disturbance, and it can also cause the super infections. Okay, so this is all about the chloramphenicol. If you still have any question, you may ask in the comment section. Thank you so much.